Good afternoon, everyone, and thank you very much for coming. I'm sure a few more people will join as the introduction's going, but we're really excited to run this event. And as some of you will know, this is the culmination of a series of different reviews, events, discussions that we've had going. And yeah, we've got quite a packed agenda. So Taryn, if we go to the next slide. So we've got some really great speakers as part of this event, and we're really pleased to have Oyster Technology joining us today. They're our headline sponsor for the event, and the sponsorship that we receive for these events really help make all of these activities sustainable for us and help us kind of build out our capacity a little bit. So we're very grateful for that support. Alongside Philip, we've got Jackie from Sentai and Suzanne from Mobilize. We'll hear from them directly in a few minutes. But if you go to the next slide, Darren. So I'll start off with a little bit of a presentation of some of the research findings. That'll cover some bits from the 4 reviews that we've launched over the last year. And then we'll look at some of the more overarching perspectives for the sector, and then we'll go into a bit of a panel discussion and get some questions from the audience. So throughout the session, whether it's during the presentation or the discussion or any bits, please do pop your questions in the chat, and we'll get to them. If we don't manage to address all of your questions today, what we normally do is follow up with you afterwards over email, because we get your email address with the question. So without further ado, I'll go into the presentation. Okay, so as I mentioned, we've been conducting some analysis over the last year, very much looking into the technology being provided by startups and small companies to the care sector. So before I go into the detail of the research, I'll start with a bit of an introduction to Future Care Capital. So we are first and foremost a charity, and we conduct research, run practical projects and programs, provide advice and consultancy, and we work with a huge range of different stakeholders, and this is all for the benefit of our beneficiaries, who are all those in receipt of care in the UK. Our work focuses on different strategic areas. So you can see those here: data technology, innovation, investment, and climate. If you're interested in any of these areas, please do get in touch with us, because we're always expanding our work on these. And the series that we're presenting today comes from the technology pillar of work that we have. We're really lucky to have an excellent series of partners and collaborators, and our work gets picked up in national and international journals and news outlets. So we're really grateful for all the coverage that we get, and we really rely on these partners and the people that we work with. So at the beginning of this piece of research, some of you will have seen some of this before, but we started off by segmenting the care sector overall. And to be honest, that was a really difficult task, and we found it quite difficult at times to really define boundaries and think, okay, well, what is specifically care and what's more healthcare? And we ended up segmenting it into 4 different areas, which over time, the disability care section, we actually specifically looked into learning disability care, because we realized that actually that subsector of that really warranted a detailed exploration, and there wasn't really much literature out there already. So we wanted to kind of take a specific look there and build it out a little bit. So needless to say, there's a lot that sits outside of this research, and there are definitely opportunities for more research going forward, and we're really keen to start to think about condition-specific technologies and particularly things that maybe can improve end-of-life care and things like that that don't necessarily fit into any one of these areas as it stands. So the first review that we conducted was on domiciliary care solutions. And it was really interesting to think of it from the perspective of the different functions that the technology were performing and the sorts of people that would be using those technologies at different touch points. So if you look at this diagram over on the right-hand side of the slide, we can see where people are interacting with the technology, and what sits over on this side is very much direct to service user or directly caring technology. And then over this side, these two domains are much more about management, analytics, things that can really help the workforce and the management of the whole care scenario. Consumer technology in this space is really rapidly expanding, it seems, and things like IoT sensors and consumer tech that we would consider as just general technology that we have on our person or around our home are starting to really grow as very useful tools in this space. And there are some signs of quite advanced technologies like artificial intelligence and machine learning developing here. But as you can see, it's still a relatively small portion of solutions for the size of the market in the long term. So the next area that we looked at was mental health care. And it was really interesting to see that a lot of these solutions were very tailored to individuals and people interacting with their different therapy options. And what was quite interesting was that rather than, say, artificial intelligence, there were things like virtual reality and gamification of the apps and solutions that were being developed. So it's all about engaging people and getting them more interactive with the care that they're engaged with. So that was a really interesting series of companies, and a little bit larger than the home care portion. Then the learning disability solutions was a really interesting subsector. There are kind of a combination of some really advanced technologies. So some IoT technologies in this space were doing quite unique things that we weren't seeing in other areas. But then it was an incredibly small pool of products. So there's less than 20 solutions on the market for learning disability that we could find. But interestingly, there were a lot of the solutions were focused on how users can better engage with content or better access digital information. And if we think of the pandemic and things like that, a lot of the advice and support available is online. So making online sources of information accessible is a really crucial thing for care and indeed health overall. Then the final review that we did at the end of last year was looking at residential care solutions. And what we saw here was some really interesting workforce tools. There wasn't a huge amount focused directly on those in care settings, so people using the care services themselves. It was very much about monitoring people, managing the workforce and care provision. But in terms of really enriching people's lives and providing them with technology-based experience as part of their care, that was quite limited. But this was I think the largest pool of product overall. And then in terms of the distribution around the country, what you see here is each pin is a company, and then each sign on that pin or post is a different product. So some companies have multiple products across different sectors. Others are just focusing on a single product to a single sector. It's quite interesting the density of companies that we see in London, and there's just under 70 in London, and then it's fairly fragmented around the rest of the country, but in a few slides we'll see where some hubs seem to be developing. So as I say, London is the main centre, it seems at this stage, but then it seems that we're starting to see other areas is developing as hubs, but they definitely need a little bit of support to go a bit further. I think this chart here is really interesting in thinking of how subsector specific a lot of the solutions are, and where there is starting to be overlap. We didn't find a single company that was catering to all of the subsectors, but there was overlap of all of them to a certain degree. The technology that we see the most of is mobile applications. So that's things that would be on a phone or a tablet that either care users or part of the workforce can take around with them, and it helps them in their day-to-day. The most advanced technology as an emerging subsector is definitthat the Internet of Things. And the use of sensors in this environment is really interesting, particularly for the data that they can get out of an environment, and how that can be used for analytics and insights, and eventually building artificial intelligence models. Just before I move on, it's useful to note that while there are some examples of more advanced emerging technologies appearing in the sector, many solutions that we see being applied in other sectors. So we think of distributed ledger technology, cybersecurity companies, and kind of augmented mixed realities and autonomous vehicle systems. They still seem very much in the R&D space of the care sector, and it'll be interesting to see where those go over the long term. It's great to see that some questions are coming in, so please do keep those coming. And then I really would urge you to take a look at the report if you haven't already. We'll share it after the session. But there's a bit of a SWOT analysis in there, and a series of recommendations for the sector, and particularly for the growth of the market and the growth of the technology as more of a defined ecosystem, rather than this fairly fragmented setup that we currently have. But I think it's really useful to focus on some of the opportunities, and yeah, I think we'll consider a lot of this as part of the discussion. But if there are particular areas of this that you would like us to discuss as part of this session, please do highlight them in the questions. But thank you very much, and we'll start to move to the discussion now. So if the panelists would like to join, just waiting. Lovely. So if we start with, I'm going to go around the order on my screen. And what we're going to do now is just have a short introduction to each of the speakers, and a little bit of background of what they do and what their company does. So Jackie, if we start with you.
Sure, no problem. Hi, everyone. I'm Jackie. Hopefully you can all hear me and see me. So I'm a regular attendee at FCC events. Delighted, honoured to be a panellist today. I hope I do it justice. So I've worked in IT for almost 20 years, hence all this grey hair that's going on. I've had a variety of roles. I've been in technical support, been an IT manager, a delivery or project manager, a business analyst, which you'll probably see coming out as I speak, a product owner, and now I'm a product manager for Sentai. For anyone not familiar with IT roles and the names by which we call ourselves, as a product manager, I'm working with colleagues to create a product roadmap for feature development. I'm collaborating with the technical team on software development and implementation. I'm creating user stories which detail the product requirements for product features and services. and I'm reviewing product usage analytics and user feedback to agree our continuous improvement needs. Being completely open and transparent, we're a small enterprise, a startup, so there's also an element of all hands to the pump. So at the moment we have a number of trial users onboarding. So now I am called Customer Success Hero, is also one of my current roles. So Sentai itself, Sentai is a unique product for older people who wish to remain independent and living in their own homes. Often it's been the family home for decades, and they really would like to remain there and remain independent. We use Alexa voice technology. However, we're using it proactively, so there's no wake word for people to have to remember in order to get Sentai speaking. We have a clicker that people can wear and carry around with them and use to activate Sentai. And for a lot of the reminders and activities and interactions, they're pre-programmed so that they will actually activate at the time that the user has asked, or that their relative or carer has put into the companion app a particular reminder. The reminders that Sentai initially is focusing on are those things that are important to daily living activities and managing the tools of daily living. So, for example, we have regular wake up and bedtime interactions, food, hydration interactions, very importantly, medication reminders, and also questions, did you take it? And reporting that medication adherence to the relatives. And we also now allow personalised reminders. So you'll be able to enter into the companion app, I would like Sentai to say, hey mum, it's 10 a.m, why don't you have a cup of coffee? Or hey dad, it's Tuesday, put the bins out. So this is much more personalised. We have a shopping feature, and we also have, very importantly, emergency help function. So a click and hold of the clicker will spark an emergency alert. Notifications will go to the companion app and the mobile phone that the app is on. And so the relatives are able to respond. We capture what the problem is. We capture whether somebody can get to the phone, because there's nothing worse than knowing mum's fallen, trying to ring her, and you don't know whether or not she's not answering because she's in another room or she's actually more seriously hurt. Just conscious of time and rattling through a few things. We've created augmented voice technology, so Sentai, in our opinion, is much more human sounding, less robotic than other devices. We're using that interaction data that we get back as AI and machine learning. So over time, we can personalize the user experience. As I've mentioned, we have the companion app for relatives, and what we're finding is the peace of mind that the reporting in the activity feed, we knew that that would be important, but the feedback we're getting is just how much that has changed the relationship that somebody is having with their elderly relative, because often it's turned from being a child to actually looking after them, whereas the older person gets some of that kind of independence and the way the relationship used to be back. Just to finish up, before I talk about my perspective, we're looking at future features to include emotion detection, AI conversation, and calling others to chat in order to address loneliness, which, as we know, is a big problem. So just to wrap up, my perspective and the insight I bring to this discussion, I believe, is that I've worked on digital transformation projects at a small and large scale. I've carried out business process reviews and recommended and implemented improvements. I strongly believe that technology can play a role in providing solutions for a variety of problems that we all know exist in the wider care sector. And finally, I just want to help. I believe Sentai can help. I like helping. I've always worked in environment, health, education, and that's what I do.
Thank you, Jackie. And I'm sure across the panel we all share those sentiments, and yeah, it's really nice opening for the discussion. So next, if we go to Philip.
Well, I'm glad you made it really easy for me to follow, Jackie, by being, you know, as clear and concise as you could. That's great. So hi, I'm Phil Bridges. Thanks, Peter and FCC for arranging this and having me on. I work for Oyster Technology, so we are an SME based out of just above Milton Keynes, in between Milton Keynes and Towcester. And we have been around for about 13, nearly 14 years in the mobile telecare space is where we started. So this was driven out of, and it did give that background, it was driven out of a realization of the slightly strange world of adult social care and appearing on their radar, that the moment you did, you were given a button and box to put in the corner of the room, and you had your little pendant round your neck, and the initial instruction was, here you are, here's your alarm. Now, just remember, it doesn't work if you go out. And that psychological marker stamped firmly down, you're not safe if you leave the house. Let's make you isolated, let's reduce your activity, let's do all those really, really positive, I'm joking there, obviously, things that change the outcome for that journey. So there we are, you know, sort of 13, nearly 14 years ago, where Mario thinking there's got to be a better way of doing this. And that was the start of mobile telecare, and that journey towards providing technologies that break down the four walls, actually put the communication in the hand of the person or available to the person wherever they are. So, you know, really trying to open up the borders and deal with a load of those really, really low level but massively important factors that drive the positive outcome and the effect on, you know, in the end, you know, taking Section 2 of the Care Act, about really delaying that process towards that really high cost impact on the central purse. So that's where we start. That journey has been probably very, very interesting and slightly difficult at times, because I think developing any technology into a market like that and then trying to change what was something that had been, you know, without change since 1980s, I guess, was the beginning of the button and box, has been a challenge. So we've weirdly been a disruptor for over a decade, which feels like a very strange thing to say, that you have to be a disruptor for that length of time, but we have been. And that has led us to understand this market really quite well, to understand the fact that mobile telecare can deliver great things, and actually to start to look at the other parts that make up that picture to hopefully really improve the outcome for what we call our VIPs, our vulnerable independent people, because they are, you know, and that has been a central ethos to the business throughout that time, is that the VIPs are everything, literally everything. So we now have a range of devices, because as the emergence of person-centered care became a thing, person-centered care, it is a little bit of a running joke in the office. The organization's talking about person-centered care, and then they show you their one device. I'm not quite sure how that works, but anyway, I'm sure there is a degree within it, and hopefully as we get more into this technology, there will be more technologies, because it's not about one, it's about the, you know, the overall benefit to us all in the long term. So we have a range of devices that communicate, and we're now looking at not just the barest minimum of, can someone press a button and call for help no matter where they are? Can we see a little bit more about their lifestyle? We now have a very large IoT platform that we connect all of our devices into, that allow us to start looking at some of the warnings that we can generate, and some of maybe the insights. Let's look at the change. Let's look at what's going on. Let's see if we can make those interventions at the right time. Let's actually draw the data and do something useful with it. And I say that whilst having this against the background where the default for adult social care is yet again still to put a button and box no matter what. So there's a real education piece around this and a definite cultural change that we are very, very much involved in, and trying to work with a load of authorities who are, you know, are predominantly our business. to try and look at what that roadmap looks like going forward. So now we sort of step into where we are today. Today is still about breaking down the four walls. It's still about having the ability to call for help no matter where you are, in the house or without. But it's also about looking at what other things can we pull in. Now we have this IoT platform, which we call IntelliCare, and what we can generate from that. So let's look at the activities of daily living with other sensors that then pull into it, and include sensors from other manufacturers so we can actually get more data sets. Let's look at what we can actually really tell when we start to dig behind the data, and not have that paralysis by analysis when we've literally overloading some poor case manager who literally has got to go through sheet after sheet after sheet of data. Wouldn't it be just better to say, Phil's okay, there's nothing to report, Phil is living his life, Phil is growing old disgracefully? By the way, that's definitely on my roadmap. And then what we'd really like to do is take this, and the next generation for us is the bring your own device world. Because actually, Jackie's absolutely right. The interactions are all changing. We're all becoming more tech savvy. We all have different ways of interacting with our data. But what we still will always need is that resilient, penetration tested, fully capable system that allows what we do in our world, which is to connect to multiple alarm receiving centres, professional people who can deal with it, to deal with those situations that sometimes, that £500 million worth of unpaid care that's provided is not available. And then we can actually move the data more effectively to try and generate a better outcome for the VIP. So that my viewpoint is, that's gamify getting elderly. Let's make it the fact that, going beyond your four walls, not being isolated. Let's have coffee shops saying, do you know what? If you come in between these times, we'll give you a discount because you're over a certain age. Let's fill the gaps. Let's give not people the ability to go out, the reason as well. So there's many, many other parts in that. As you can see, I could wax lyrical for this forever. I'll stop talking, Peter. Sorry.
Thank you, Phil. No, that ending point there, I think that's a really interesting one, which it will definitely unpack a bit. Last but by no means least, Suzanne, over to you.
Thank you. And hi, everybody. Really great to be here. I'm Suzanne. I'm co-founder and head of carer support at Mobilise. And I guess what I also bring to this conversation is just my own perspective. I've been caring for my husband, who was diagnosed with young onset Parkinson's 18 years ago. His dad's just moved into a care home. His mum has just been diagnosed with Parkinson's as well. So we're kind of on this whole journey and just see how completely, as humans, this is something that's really important for all of us. So Mobilise is kind of sitting underneath those four sectors you described, and all the people that unpaid care, those 13.5 million people that are caring, probably don't call themselves a carer, their family, friends, etc. Really important to recognise that. Could be us one day. I seem to have dived in a bit early, but that's where we are. But Mobilise has an online service that harnesses the collective knowledge, wisdom and expertise of those unpaid carers, really brings it together. We empower those that are caring for family and friends, for their loved ones, to thrive whilst caring. That this should be, like Philip says, it's going to be an enjoyable experience. It's still going to be life. We're still going to do some good stuff while we're doing this. Our tools are mobile friendly. We've really learned that people are mostly accessing stuff on their mobile phones. They're not sat at a desk doing caring work. They're there filling the kettle, etc. Super simple. Really important that they're super simple and actually work on fairly basic smartphones as well. You don't need the latest iPhone technology. It's really important. And those tools help us to both identify, connect with and support carers, and importantly at scale across the UK. My personal perspective, understanding once I identified myself as a carer and recognising what support was available, it was kind of during the working day at my local community centre once a month, and wasn't always right for me. So I've always had this passion that different types of support are necessary. I have a background. I'm an ICF trained coach and done lots of facilitation work, both online and face-to-face, and run some great programs that are really impactful, really person-centered, really strength-based. And I'm so keen to see that happen at scale. How can we get that out of the community centre and into everybody's homes and into everyone's real lives on a daily basis, so that there's less limits about that. And how can we make those connections? So many carers are often housebound due to the person they care for, or particularly now through COVID, and now levels of anxiety are still really high and people are kind of struggling to make those moves out. So encouraging people to make those connections and move forward. We're currently working across 19 different areas across the UK, partnering, like Phil, with local authorities, NHS, emerging ICSs and carer support organisations to sort of, our biggest job is about identifying carers earlier and making sure that they really reach that scalable support, so that those organisations can support way more carers than the current numbers they're supporting, and be ready to grow and ready to scale. My co-founder James and I, we believe that reaching people at that earlier stage can really help to avoid crisis situations, carer breakdown, and that using those coaching principles in our work, both we do lots of one-to-one real human stuff, get people in real life groups and actually talk to people, but then apply what we're learning and what works into the tools that we have. So I don't have a massive tech background. I worked in hospitality and in sort of systems in hospitality for a while, mostly customer service. But it's about, how can we make this happen? Come on, guys. You guys that know how it works. Let's get the tech working. Let's make it super simple for people to use. Let's make it super accessible. But just knowing, if people can access that kind of support at an earlier stage, it can mean they can take charge of their own situation. They can make choices while there are still choices available about what's going to work for them. They can engage more of the family or more of the caring circle around supporting someone. It doesn't all have to fall on one person. And just recognizing that we're all at some point going to be impacted by this. We're going to either be cared for or be caring for someone, and we'll need to step in some way. And it might be that we need to find the technology and the resources, and we're better to learn from than others who are already doing this and have already found some of those answers. One of my favorite discussions in our Facebook group is around Alexa. How are you using that? How are you using Google Home Hub and things? And the creative solutions people have come up with is fantastic. And I've just set her off. I knew I'd do that. Should have switched her off.
No, and mine.
But yeah, just that connection and community combined with the tech and combined with the coaching principles, that we can really have a huge impact is the excitement. I'm really excited for what tech can do. I'm really excited personally to hear about other products that are being developed, as we started to think about mother-in-law and falls is the main risk, because she's living on her own now. What do we do about that? And starting to think there's different solutions than the button and the box in the corner. It's really great.
That's excellent. Thank you. And I think even with the little amusing moment there, that highlights some of the challenges in bringing tech into the home, doesn't it? But no, it's that was really useful. Thank you. I'm going to start with some questions. We do have some pre-prepared ones, but interestingly enough, as often happens, some of the same questions have now come through to the chat box. So I might start with a combination of one that I was preparing with Tommy's here. So hi, Tommy, great to see you, or have you. So this is about co-production of digital solutions. And so this question is focused largely on people using care and how they've been involved in digital co-production. But in a way, I want to build that question out slightly and include not just people with lived experience of the care itself, but also providing care and being part of the care workforce. So I might go to you, Suzanne, first on that, and then bounce it around for some other ideas.
Yeah, I mean, co-production has always been really important for NHS, for local authorities, for the third sector. It's been a big way that they do their work. And so seeing that happen alongside how tech is designed and bringing those two worlds together, I think it hasn't always fit to start with. Quite often how it's been done traditionally is in focus groups, in surveys and things like that. And it's been the same little bunch of familiar faces that have quite often fed into that. And so the solutions haven't always kind of had that creative kickstart. And I think certainly I know for carers, but I also know, for the people they're caring for people making use of needing services, their time is really precious. And, you know, we need to be gathering this kind of information and insights as we go without them having to stop and tell us that this needs to be that kind of continuous feedback loop. So for us, having a community was really important so that we can soak ourselves in with them, understand the problems and learn from the solutions they're finding themselves, and, you know, be inspired by that, I think, is really important. Really good listening is important for us. We've run our daily cuppers now for 2 years. We hit 500 cuppers that we'd run with carers every day, different topic, different people coming in. But those cuppers were supportive for them. They weren't there to help us. They were there to get support for themselves, but they've been a really big, good listening pool for us. And then the tools that we have, you know, they're collecting data and user behavior without the users kind of really being, you know, hugely inconvenienced by that. You know, they're not having to give us extra stuff that's just going to help the information. Any information they give us is going to help the service they provide and make it more bespoke to them. So that kind of learning where we can, but also engaging them in the fact that we're new, we're trying something exciting. So whenever we've shared like a new email course or something, this is new, we've just created it, tell us what you think, what else would you have liked to see? And when we're creating new tools, yes, they get involved in kind of research discussions and design discussions and actual planned user testing. But a lot of it is, hey, it's up, it's running. We know we're still going to, it's not finished. We're still going to build on it. We're still going to improve it. But before we get too far, tell us what you think. Tell us how it's going. So those have been, you know, those kind of ways of infiltrating, not creating extra work for them or giving them another job to do, but also making sure that we're reaching a real diverse group of people, not just the people that are at that stage where they've been experiencing crisis, they've been caring for a very long time, they're used to all the systems and processes. People that are new, they're still working, they're using all sorts of tech at work, they're using different solutions in their community and elsewhere in their lives. Drawing on that sort of diverse range of people has been really important too.
That's really useful. Jackie and Phil, do you have some comments to add to that?
I'm very interested in the kind of listening, the idea of the cuppa, because in my role certainly should really be sort of 80% listening to people, listening to user needs and computing those, and then 20% is talking to the developers about how we can solve those. So that's very interesting. As a product manager, we got the concept of the 5 whys. If somebody tells you their problem, it's not really the problem, so you ask them why, and they'll say another thing, and by the time you get to the 5th why, you're getting to the nub of the problem. So that is very interesting. And even just being in a larger sort of wider care sector network now on LinkedIn is so interesting. Quite emotional as well sometimes, moved to tears with stories, I have to say.
I agree. And I think there's some really useful tools there that people can use. And it's interesting, when we were setting up the research early on, we were trying to think, okay, well, can we quantify across the whole pool of companies throughout the research? Can we quantify who's using co-development and co-production, and who's actually saying they have users involved in their design and reiteration processes? And it was really difficult to assess. And I think learning disability was the only subsector that it was actually something that was mentioned as something to be proud of on the website. The other subsectors don't really mention it anywhere visible. Phil, is there anything you think about that in terms of way forward?
I think Suzanne makes a really interesting point there, actually, which I think is key, is about people who have become very used to what's available and have lived with that learned experience of care. That there is a danger of, in the Henry Ford, if I'd asked the public what they wanted, they would have said faster horses. And I think that can be a little bit, can inhibit a little bit where we're trying to push the boundaries out a little bit. I think the key thing is that it's overcoming that underlying fear. And unfortunately, the reality is, and I'll actually, it's the first call I've been on since my dad received his diagnosis for vascular dementia this week, which for me has been devastating, because I've spent the last 10 years telling people in meetings that statistically now my mum is going to die before him. And I've used that statistic for 10 years, and it only came alive this week. So I'm really aware of the fact that we need to really look at this stuff and make it come alive more. So Suzanne, I really want to echo, that point about, let's have innovation by looking beyond what we already know. For me, within the telecare world, literally the same button and box is provided today that was in 1986. I feel like I can say no more.
It's a really good point. And so there's quite a few questions in the chat about more kind of generic things of things like, is the session being recorded? Will the report be sent round? Is there a list of companies? All that stuff. So we're recording the session. We'll share it afterwards. And yeah, you can access it all on demand. And yeah, we'll share the report. And if anyone wants the full list of companies, they can get in touch with me. Or you can laboriously go through the 4 sub-reports and copy and paste them. But yeah, get in touch, because I'd like to talk to those of you who are interested in the full set of companies. So there are a lot of questions about adapting technology for learning disability. And particularly if we think of the 3 products here and your focuses, where do you think, and I'm going to broaden out slightly from learning disability. I'd like to focus a bit on learning disability, but also think, okay, what about the other subsectors that we've covered in the research and that we're interested in long term? So I might start, Jackie, with you and go round and see what you guys think.
Sure, no problem. So it's a great question, because I was interested in the report for learning disabilities to see that actually it wasn't a sector where they were using other solutions and products that other sectors had designed. It was much more bespoke. I can't really speak for Sentai in terms of Sentai itself as a product. However, we do have a young man who's at Southampton University who has Asperger's syndrome, who's currently using Sentai and has all of his learning schedule and classes schedule in Sentai, as well as gentle reminders for daily activities, because he loses focus. So that's going to be a very interesting piece of work. My sort of quite strong opinion really is that we can do a lot more with the technology that we're developing for, say, older people in their own home for other subsectors. So I know, having read the report and seen a lot of information available online, that most sort of common solutions for mental health are apps. There's millions of pounds being invested in millions of apps, which basically just prompt you to answer questions about how you feel. I'm probably doing them a terrible disservice, because I do know people who use them and find them very beneficial, but I do think we can do more. The interesting challenge will be around having product trials and asking people in various situations to try products and see how they get on with them, and in particular around learning disabilities, a challenge will be data protection and consent, obviously. So yes, I could talk all day about that, but happy to throw it open to others.
I think that's really useful. There's also a question around barriers to the sector, and I'd just like to really highlight that last point that Jackie made around kind of product trials, evidence, and consent, and kind of marrying what's ultimately not a very regulated part of the sector at the moment, and kind of there's not that machinery for trials and certification and visibility of all these things. So that's definitely an area we want to explore going forward.
Yes, definitely. In terms of a challenge, I do think that there's a danger that data has become a bit of a dirty word, with Facebook and the person in the corner over there that's not listening, that everybody thinks is always listening. It's a cultural shift. It's a challenge to overcome, because data, essentially, at the end of the day, it's just information. And you're either happy to share it or you're not. And when people know it, they'll help you. It might be to buy a certain pair of socks, or it might be to wake you up at the right time, because we know that's the best time for you to wake up.
Absolutely. No, I think really good points. And Phil, over to you.
Yeah, so I guess from the LD perspective, we've been involved in a number of projects and activities around that, and we're very much at the physical end of this, of course, because we're wanting to see movement and activity and engagement. So I can certainly say that within the LD sector, travel training has been a real area of success for us. So the idea of allowing for that great re-inclusion into education or to work, removing that need for the person to travel, have someone travel with them, to have some sense of ownership of your own life, to enable with technology, I think is fundamental to what we do. And again, a lot of that is about pulling on multiple strings and getting a larger scale buy-in from all of the parties involved, because I think from a case manager's perspective, it's scary. I think from the informal carer's perspective, even scarier. So actually to get all of those hearts and minds involved in this process is actually a big part of it. And I wonder how much more we can influence that from a governmental level, about understanding the fact that it's okay. I think that's one of the pieces that is missing, is that I think we've stepped away from the acceptance of I feel for my daughter. She lives in a little village with me, and she doesn't see anyone out walking elderly. She feels that it's not beyond. When I grew up, I literally felt like everyone was old in the village that I lived in. So something, there has been a sea change. So how we engage with that, how we get some form of acceptance. I think these are all the things that need to sing into that.
Absolutely, thank you. And just a follow-up comment from Tracy Richards from MenCap, who I must say a massive thank you to, because she helped design and conduct the research on learning disability technology here. So she's said that consenting capacity can be supported for people with learning disability, just takes more time, which is an excellent point, and that it's more the loved ones that fear the data issue, which I think across all subsectors here, it's a really crucial point. And I'm just going to come to you, Suzanne, on the learning disability application point, because I think it's really interesting from your perspective.
I mean, it's a broad topic, isn't it? And so even as we say that word, we're imagining a whole different range of situations and personas. But I think one of the most important things for us was to remember that quite often the person doing the caring may well also have a learning disability, maybe speaking another language, may have their own physical and mental health issues. That it's not as as kind of separate as the carer and the cared for. It's often quite mixed up, which is lovely. But so when we kind of try and design stuff, whether it's content and things, someone said, "Oh, should you have an easy read version of this? Shouldn't everything be easy to read? Let's not, try and have to make something so complicated that we need an easier version of it." Everyone wants it easy, but also just learning and listening as we go. I think our experiences, we're still quite new to that, but staying close to the users and close to our community means we're hearing more and understanding more about what people are sort of getting to grips with. And it's things like, we send out all sorts of communications and things, emails and what have you. And it's not like being at work where you're sat at your desk and working through emails. People are overwhelmed by it. They find it confusing. They didn't know where to click. And it's all those sorts of things that we can listen and say, that's us. That's not you. That's us. If that's how difficult it is, that's our design that's the problem. And you don't need to go off on a training course and learn how to use it. We need to be better at design. So I think bringing the right people into that testing and the conversation is important, and kind of keeping open borders really to make sure that we're talking to everybody. But also I think there's a lot we can learn from each other, and so that as some organizations would be competitors, but when it comes to making things truly accessible and usable by everybody, that's hopefully a real big shared mission that we can come together on.
Absolutely. And I think with the people here and in the audience, there's definitely will to create change there. So people in the audience, I can't see you unfortunately because it's the world we're in at the moment, but please do get in touch. And all of this discussion ties in very well with many of the plans that FCC have going forward. So please do make contact. I can't believe how quickly this session is going. So I think we've probably only got time for one more area of discussion. And I'm going to be a bit selfish from an FCC perspective and choose the question about self-funders because it's really interesting. The question is, individual self-funders more open to purchasing and using technological development than public sector, brackets, local authority commissioners, or vice versa? This is a really interesting area, and I think all three of you have some really interesting technology for this part of the discussion. I might go to Suzanne first on this one.
Yeah, when we set out, at the heart of what we do is recognizing a lot of people, money is a real issue. So we wanted to make sure we always had something on offer that anybody could access, regardless of whether they were paying themselves or whether their local authority was funding it. So there'd always be something free has been really important. So to make sure that's kind of at the base of what we're offering. But I think it is interesting. I think there's a kind of potential divide there. And I think I wonder, if that helps to accelerate development, then fantastic. If there's a sort of consumer out there that will pay. But essentially, I think if we want to get this sort of technology really moving fast, then the public sector can make a huge difference there. And at the end of the day, it's still the public sector that wins. It's the public purse that wins from that investment and seeing it as an investment. And it's a bit of an icky place, isn't it? Sort of seeing, actually maybe we'll get these people to pay for it, but you can't have it because you haven't got enough money and local authorities not paying for it. I don't think anyone really wants to be in that space. But, wherever's going to help the tech to develop and create the innovation for the future is, I guess, where we need to move and work with, And so I think where you talk about bringing your own devices and those kind of things, the kind of whether it's your Apple Watch or your phone that does stuff and things just becoming more widely used and things having multi-purpose. This is not just to support you because you're elderly and vulnerable. This is what everyone's using at the moment, and it's fun, and it's going to help you have a better life. Maybe those things make them more attractive as well. They're more about lifestyle.
Absolutely, thank you. And I think Phil, it's good to hear from you on that next.
Hey, Suzanne, literally singing from my song sheet. Yeah, for sure. I think there is something quite perverse in it. Actually, is the fact that we've been doing this for a number of years. The reality is actually, if you're a private pay self-funder, you may well not come across our technology because we are provided by every local authority. So you could miss out on all the enabling that can happen with our technology because you don't want to appear on their radar. Now, there is definitely a piece missing somewhere in the middle there about a big trusted brand that should really be taking this on. And I know that it's been tried before. O2 tried it 7-8 years ago, I think, with Help at Hand, I think they called their brand, and it literally wound up almost before it launched. So there's a piece missing there somewhere in the middle, and we're trying to do a lot more now in that space in terms of trying to reach those self-funders that actually will benefit day one, straight away, engaged, not having it forced on them, making the conscious choice, having the reward day one. Absolutely. So reaching them. Please, if there is someone who's listening to this who's got that great idea, please find me on LinkedIn straight after this and tell me how to do it. That would be great.
Thank you, Phil. And last but not least, Jackie.
I'm sure, no problem. If I can play I'm fairly new to the sector card on this one. I think really I can't add much more than Suzanne and Phil, really, other than I think from my perspective, this is around the collaboration piece. So we are at Sentai talking to a number of domiciliary care providers, and they're super interested for including Sentai in their care packages. Would like to try it out first, but the challenge is they have absolutely no time to do that, because they're all hands to the pump and recruiting, and that's all they can do alongside turning people away for new care packages because they don't have enough staff. So we won't go down that path anyway. So just to talk about some collaborations that we're doing that we hope will lead to talking to local authorities, etc. So we collaborated with Plymouth University and their EPIC program. They're doing a trial with Sentai where they've asked people for an evaluation piece. So their main focus is around living well and digital care for Cornwall specifically. And we're just talking to a London university at the moment about doing a piece of collaborative research with themselves and a large local authority near London into living and aging well and dementia. So being new to the sector, as I said, it's we can only take that on face value and hope that that will lead to something, not from a marketing and sales perspective, but from the perspective of helping people.
Lovely, thank you. It's been such an interesting session, and there's so many questions still left to answer. So we'll definitely be following up outside of the session to touch on some of those. So all that's left really is to thank everyone. It's been a year's worth of research and projects that have led up to this point, and there's some really exciting next steps ahead. So I look forward to announcing some of those in due course. But really want to thank all of the speakers here and the panelists. So thank you very much. I do miss the days of having real life applause and also a beer and a pizza afterwards. Why
don't we do that?
Yeah, one day it'll be back, the old meetup. I'd really like to thank Oyster. Your support on this is very much appreciated. We really wouldn't be able to do these sorts of things without that sort of support. So thank you ever so much. Through all of the research, we had different advisors and partners for designing the research, inputting and making sure that we were looking in the right places, and if there were blind spots that they were highlighted to us, and that was incredibly useful throughout. So thank you very much to everyone who contributed in that way. Through the three reports that happened through the bulk of the second half of last year, New Market Strategy came on board to help us with that. And I just want to say another really big thank you to Chris and Ron. We couldn't have done it without you at that point. And we're very, very grateful for all of your help with that. So the last thing to say is thank you everyone in the audience who came, and I hope you enjoyed the session. Please do come to our next session, which is on the 8th of March, which is looking at the wider sector implications of digital technology. And that's with NHSX and Ipsos Mori in association with some of their research that they launched at the end of last year. So I think together the sessions will provide a really good context of sector, technology and startups, and kind of both sides of the development and adoption equation. So thank you everyone ever so much, and really nice to see all the speakers and see you all soon. Thank you.